Broadcast is now starting. All attendees are in listen-only mode.
Welcome, everyone. Thank you for joining us for today's presentation of the 2021 Community Health Needs Assessment. Today's session is being recorded for future viewing and reference. This Community Health Needs Assessment is brought to you by a partnership between Good Shepherd Healthcare System and CHI St. Anthony Hospital. My name is Jessica Reeker, Director of Community Health and Outreach at Good Shepherd. I am joined today by Caitlin Kozad, Marketing and Communications Director at Good Shepherd, and Emily Smith, Director of Marketing, Communications, and Foundation at CHI St. Anthony Hospital. Presenting the CHNA findings and hosting the prioritization exercise today is Bruce Lockwood, Senior Vice President, Community Health with Professional Research Consultants. Welcome, Bruce, and thanks for being here.
All right, thank you, Jessica. And welcome, everyone. We're excited today to share with you what are really some very recent findings from the Community Health Needs Assessment completed by Good Shepherd and CHI St. Anthony. Before I get into what I want to share with you today, I want to cover just a couple things about today's event. As you may have noticed, all of our attendees are in listen-only mode, so you are automatically muted, although we do want this to be interactive and want you to have the opportunity to ask questions. And you can do that via the questions or the chat dialog box that appears on your GoToWebinar dashboard. So at any time during my talk today, feel free to enter any questions that you have about the data that I'll present or the assessment overall, and we'll have some dedicated time at the end of the data presentation to answer those questions. As Jessica mentioned, I wanted to reiterate that today's event is being recorded, so by participating, you are giving your consent to be part of this recorded event. The last piece that I wanted to cover is that we want to get, as part of today's event, some feedback from you around the issues that I'll be sharing. And to do this, we're going to be getting some voting underway, and that'll be done through a web-based platform. So we'll need you to have access to either a mobile device, a cell phone, or a tablet, or if you're on your computer, you can open up a web browser and participate that way. So that'll be a piece that I will talk about a little bit more just very shortly. So what I plan to talk about today is really highlighting some of the top findings from the Community Health Needs Assessment that was recently completed for the health systems. What I present today, though, is really just a fraction of all of the information we collected, but the full assessment data is available in the reporting that is available through the hospital websites. I'm going to focus today primarily on what we call areas of opportunity, which are the significant needs that emerged. So I'm going to focus a little bit on the negative today, but there were many positive findings for the area as well. And as I mentioned earlier, we'll have some time after the data presentation to answer any questions you have. So feel free to enter those at any time through the questions or chat dialog boxes on your dashboard. Part of what we want to hear from you is going to be a process at the end of the presentation today to get your feedback around how should we prioritize some of these health issues that I'll talk about. And to do that, we'll use that voting platform that I mentioned. So I actually want to test that out now. So I'm going to ask you to either open up another web browser or grab your mobile device and open up a web browser on your cell phone or your tablet. And I'll give you instructions how to give us your feedback. The first question I have for you now is I want to get a sense of who's with us today in terms of what type of organization you represent. So in that web browser, I'd like you to go to the following web address, www.menti.com, menti.com. It's at the top of the screen. You should, on the slide you see right now. And once you're there, it will ask you for a code. That code is also at the top of the screen right now. It is 78218632. So www.menti.com and enter the code 78218632. Once there, you will see the question like you see on screen now, asking what type of organization you represent in your capacity of attending today's webinar. So that may be healthcare, it may be business, education, a representative of a nonprofit group, or if you're a citizen, let us know that as well. So once that question pops up for you, enter your response. Be sure to go to the bottom of the screen and hit that submit button, because that is what will enter your scores to thing. Someone said that they are not seeing that question. Let me just refresh everything and make sure that it is current here. I do see some votes coming in, so if you had any difficulty, try going to that web address and entering the code once again. Very good. It looks like we're hitting different segments of the community here, which is awesome. Looks like there might be a few more folks still casting their votes. So fantastic. Well, it's good to see that this appears to be working for folks. It looks like we have definitely good representation among the healthcare sector, from physicians and various other types of healthcare providers, good representation of public health, but also business, education, nonprofits, citizen, and other representatives as well. So thank you for that. I will ask you to, set down your mobile device, or you can minimize that web browser. If you keep it open, we will have another question toward the end of my presentation today, where we'll ask you to give us some feedback around prioritizing health issues. If you close, though, you can re-enter the address in the code above. So I want to spend the next large segment of today's presentation going over some of the key findings that came out of this assessment that really just wrapped up in December. We approached the community health needs assessment by looking at collecting data from a variety of different sources, both primary and secondary data sources. We certainly looked at existing data that's out there, what we call secondary data. And these are things that are available for the counties that we're targeting through things like the census or the public health vital statistics and various other health-related data. So we did consult some of those existing data that are out there about the community. We also did an online survey with what we call key informants, and these are community stakeholders, representatives of organizations in the community, healthcare providers, various types of community leaders. individuals who tend to work with populations and have a global sense of the needs of folks that they work with. And I'm guessing that many of you attending today were asked to participate in that online key informant survey. And that survey was very qualitative in nature. We asked people to explain what they're seeing in the populations they serve. And there's quite a lot of information from these folks in our full assessment report. For the purposes of today, I'll have one slide that I'll get to shortly to kind of consolidate what we heard from key informants, but there's additional detail available in the full reporting. The last type of data that we collected for this health needs assessment is probably the cornerstone of what we have done here. And it's the piece that represents the most current and customizable information about the health of our population. And that is a customized local health survey among residents of the community. It is something that asks people about their specific health status, their behavior, their experiences with healthcare. And it was a survey that was conducted over the phone, but also included an internet-based component as well. So we gave multiple opportunities for folks to participate to get good representation across the communities for the information that we'll provide. And I want to talk just a little bit more about how that survey worked and what it entailed. So as part of the process, we accomplished 829 surveys across the targeted service area, which is Umatilla and Morrow counties. As you can see in the map that I've put up on screen, we looked at some distinct geographies within that. For example, those zip codes primarily associated with the Hermiston area, those associated with the Pendleton area, and then some of those further out zip codes in other parts of Umatilla County. Now, the survey that we administered itself was fairly long. It was over 125 questions, I believe. So it took a fair amount of time on the phone to complete, about 25 minutes on average, I think, which I know sounds extraordinarily long, but it was a survey for which we got really good participation and able to get a fantastic amount of information from community residents. The size of the sample, that 829, is a very good sample size in terms of giving us a strong confidence interval with a margin of error maximum of 3.5% at the 95% confidence level for those items that were asked of all respondents. And what's really most important is what I want to put up on screen next, is that the sample that we achieved for the Umatilla Morrow County's area looks very much like the population. So in this chart, without getting too in-depth, the orange bars represent the proportions of certain demographic segments in the two-county area according to the latest census estimates. The red bars represent the corresponding proportions achieved through our final survey sample. So the takeaway is that our survey sample looked very much like the population in terms of things like age, gender, race, ethnicity, income level. And that representativeness is what allows us to then project these findings to the larger population. So before I get into kind of some of those survey findings from the population, I wanted to have one slide that kind of consolidates what we heard from key informants in terms of what they think are the biggest issues in the community. So as part of that online key informant survey, the one with stakeholders and providers and nonprofits, we asked them to rate each of 17 health issues, identifying each as a major problem, moderate problem, minor problem, or not a problem in their community. And among those 17 health issues, the ones I'm showing now are those that emerged with the highest percentage of perceptions as a major problem in Umatilla and Morrow counties. Clearly, mental health was the most severe concern for the key informant group. They also had significant concern about COVID-19, about substance abuse issues, moving down then to tobacco use and diabetes, rounding out the top 5 health issues. So I wanted to start with this so that you can kind of keep this in mind as we go through the rest of the data, which is information that we collected through, the existing data sets or through the population survey. So you can see where these may or may not align with what the community is reporting as their experience. So on screen now, I have kind of a roadmap of where I'm going to go today. So I want to start out with just a measure of general health status, but then I'm going to move on quickly to what we call these areas of opportunity. And these are about 12 areas, 12 health issues, with a few data slides around each to show some of the findings for Umatilla and Morrow counties. And you'll notice I'm going to walk through these alphabetically. Again, after the data presentation today, we're going to get your input once again through that voting platform to begin assigning some priority to these health issues. So to start out with, I wanted to cover one question from the population survey around general health status. And this was actually the very first question of the survey to the community. And we asked them, in general, would you say that your overall health is excellent, very good, good, fair, or poor? You can see the distribution of responses on screen. Certainly many fell into one of those top 2 categories, excellent or very good. The largest swath were in that kind of middle category of good health, 37.8%. But then on the lower end of the scale, we had 18.1% identifying their own health status as either fair or poor. I will mention that this is one of the few questions in the survey that is very perception-based, but it is also one that is very highly correlated to a lot of the other information that I'll share with you today. So 18.1% rated their health as fair or poor. That tends to be the number that we watch and that we look at for this indicator. And we can do that in a couple different ways. You can see in the middle here that red bar for Umatilla and Morrow counties represents that 18.1% fair poor response. To the right of that, we can compare that to identical questions asked in a statewide survey as well as in a national survey that my firm conducts nationally. And through those comparisons, you can see that the score for Umatilla and Morrow counties is very close to what we see for the state of Oregon, but a fair amount higher, unfavorably higher than we see for the U.S. overall. On the left side of the screen, you can also see a breakout if we look just at those zip codes associated with the Hermiston area and those in the Pendleton area. And by this measure, you can see there's a little bit of difference, but really those are statistically similar to one another. Another way that we can look at the data from the population survey for the 2-county area is to look at certain demographic characteristics and understand how men responded to this question versus how women responded, or by different age groups, income levels, race, ethnicity. And I've highlighted on screen here some of those that emerged as statistically significant differences within these demographic comparisons. As you might expect, we see these indications of fair poor health go up pretty consistently and pretty notably as we get older. And certainly past the age of 40, we see a much higher percentage of adults rating their health as fair or poor. But just to the right of that, you can see there's also a very strong correlation with income level. For the purposes of these slides, this low income category includes respondents living in a household with earning up to 200% of the federal poverty level, which equates to about $52,000, $53,000 for a family of four. So it's not necessarily just the poorest of the poor. It encompasses a lot of families in Umatilla and Morrow counties. But those falling below that threshold are easily more than twice as likely of those at higher incomes to rate their health as fair or poor. Moving on then to some of these areas of opportunity. The first area I wanted to address, again alphabetically, is access to health services. And certainly an important part of having access to healthcare is whether someone has insurance coverage to pay for expenses. And we had a series of questions really designed to identify what type, if any, people have for their health insurance coverage. And we found that most, over 60%, have some type of private insurance coverage, something they get through an employer, their spouse's employer, a union, a plan they purchase on their own. 23.1% rely on some type of government-sponsored program through Medicaid predominantly, or Medicare or some other government-sponsored insurance program. There's also a little less than 5% relying on VA or military benefits. But looking at that slice in red, we found that 9.5% of adults in the pre-Medicare age group have no type of health insurance, either through private or public sources. And that percentage, if we look at it demographically, we see it much higher in certain parts of the population, much higher in men than in women. We see it higher in those lower income households than we see those at higher incomes. We also see a very significantly higher percentage of uninsured rate among communities of color, including Hispanic respondents, African American Black respondents, Asian respondents, Native populations, etc. Although I don't have it on screen, we also saw a higher uninsured prevalence in the Hermiston area than we saw in Pendleton. It was about twice as high in Hermiston as in Pendleton. Beyond health insurance, there's certainly a number of other factors that can affect access to health care. And we recognize that through a series of questions in our survey asking about very specific types of barriers to health care. And I want to talk first about those first three, all of which were more impactful locally than they are at the national level. For example, we found that over the course of the last year, 28.1% of all adults in Umatilla and Morrow County had a time when they needed to see a doctor, but they did not because they couldn't get an appointment when they needed it. 19.4% of our respondents said there was a time in the past year when they needed medical care, but did not get it because they couldn't find a doctor to see them. And 19% said there was a time when they needed care but didn't get it because they couldn't get there during office hours. those were the top three barriers that we found. They were also, each of those, significantly more impactful than we see for Americans overall. Moving from the population survey for this slide to some of the existing data that's out there, we looked at some of the resource records to identify the number of primary care physicians practicing in the two-county area. And this chart looks at that as a rate for the population size. So number of primary care physicians per 100,000 population. And by that measure, you can see that the rate for the two-county area is quite a bit lower than we see for the state or the U.S. overall. I do want to acknowledge, though, that there are some limitations to using this alone. One, that the data for this are a few years older than most of our other findings from 2017. This also does not take into account primary care that may be being delivered by advanced practice providers, such as physician assistants or other types of advanced practice providers. In terms of some of the routine care questions from our survey, we found that a little over 60% of adults report visiting a physician in the past year for a routine checkup. And that's relatively low compared to what we see nationally, where it's over 70%. So there's a fair amount of difference there. We also saw that residents of Umatilla Morrow County are more likely than Americans overall to have had multiple emergency room visits in the past year about their own health issues. The last slide I wanted to share around this issue of access to healthcare. We asked people to rate the availability of healthcare services, or rate the healthcare services available to them in the community. And you can see that for the two counties, we found a fair poor response, higher than what we see nationally. But when we dive into who was responding, not a lot of differences demographically for the most part. But the box that I've typed up top with access difficulty, we can see that it really is primarily related to whether someone was able to get those services. So those with access difficulty, much more likely to rate local healthcare as fair or poor versus those who have not encountered that type of difficulty in the past year. Moving on to cancer as our next health topic. I first want to share some information that's collected actually through death certificates. So in the public health vital statistics, we can look at the leading causes of death for the two-county area as revealed through death certificates. And you can see that cancer is a leading cause of death, really on par with heart disease as one of the top two leading causes of death, individually much higher than many other of those that we see broken out here. We also looked at something that are called age-adjusted death rates, which look at the number of deaths for cancer for the population size, and also makes an adjustment based on the age of our population. And by that measure, cancer mortality rates, age-adjusted death rates in the two-county area are generally similar to, or even in some cases a little better than found nationally. We also looked in our community survey asking people about different types of cancer screenings. So, for example, for women between the ages of 50 and 74, we asked them when they last had mammography to check for breast cancers. We found that 73.9% had mammography in the last 2 years, the recommended time frame, which is very close to what we see for the state and for the US. For women 21 to 65, about 2/3 have had pap smear testing in the past 3 years. That you can see in the middle here is a little bit low compared to what we see statewide and nationally. And then finally, we asked about various types of colorectal cancer screenings in adults aged 50 to 75 of both genders. And you can see our response there is pretty on par with what we have across the state and across the US overall, with 72.8% receiving appropriate colorectal cancer screenings. Next, I want to share a few slides around diabetes. In terms of deaths, looking at, again, those age-adjusted death rates associated with diabetes, we see a mortality rate for Umatilla and Morrow counties of 33.4 deaths for every 100,000 population, annual average during 2017 to 2019. That rate is significantly above what we see for the state or the US for the same corresponding time frame. So relatively high mortality associated with diabetes. Similarly, we did ask about diabetes in the community survey as well. And from that, we found that 13.5% of all adults tell us that they have been diagnosed with diabetes by a health professional at some point. So 13.5% prevalence of diabetes in the community right now, which is higher than we see statewide, but pretty close to what we see across the nation. Looking at the demographics of this, who we see most impacted is those in older age groups. Very consistent with what we see in other communities across the US. Diabetes is primarily age dependent. It increases sharply as we get older. And in fact, here we see that 23.6% of adults age 65 plus is dealing with a diagnosis of diabetes. Now, in addition to this diabetes prevalence of 13.5% for Umatilla and Morrow, we found another 14% of adults who told us that they've been diagnosed with prediabetes or borderline diabetes, meaning their numbers are elevated, not yet quite to the threshold of reaching diabetes. So with that, we're looking at approaching 30% of adults with some type of blood sugar management issues. Heart disease and stroke is next on my list. I want to go back to that slide talking about causes of death. Again, information collected through death certificates. And if you recall, heart disease was a top cause of death. Again, very close to what we see for cancer. 20.6% of all deaths in 2019 in Umatilla and Morrow counties listed heart disease as an underlying cause. I've also highlighted here 4.6% of deaths that are attributed to stroke. Stroke shares many of the same risk factors as heart disease, and together they are called cardiovascular conditions. In terms of risk for heart disease, we found that 36.7% of adults in the two-county area have been told by a health professional that they have high blood pressure. 39.8% have been told they have high cholesterol. Cholesterol is higher than we see across the US. Blood pressure, high blood pressure, higher than we see across the state. And if we look at other risk factors in our survey, not just high blood pressure and cholesterol, but also things like being overweight or obese, smoking cigarettes, not getting enough physical activity, it's really a high percentage of adults, almost 90%, 89.1% of Umatilla County, Morrow County adults who exhibit one or more of these cardiovascular risks or behaviors. And that's higher than we see nationally. Again, something that tends to increase with age, but it's also higher in men overall than we see in women. A couple of slides I want to share around infant health and family planning, and these are information that are collected through the public health data. For example, through death certificates, we can identify infant deaths in the community. And what I've shown on screen here is a rate of infant mortality, which is the number of deaths of infants for every 1,000 live births in Umatilla and Morrow counties. Infant deaths, meaning that a child died before his or her first birthday. By these rates, we see an infant mortality rate of 6.8 for Umatilla and Morrow counties, which is higher than what we see statewide and nationally. There is also what is called a Healthy People 2030 target, which is a national disease prevention and health promotion goal to reduce infant mortality to no more than 5.0 per 1,000 live births. So you can see we also exceed that Healthy People target. From birth certificate information, we can also identify a teen birth rate, expressed here as 32.7 births in Umatilla Morrow counties to adolescents, girls between the ages of 15 and 19 for every 1,000 girls in that age group. That too is significantly higher than we see across the state and the US as well, and fairly comparable between the two counties, really equally high in both. In terms of injury and violence, a few slides I want to share. Information from death certificates allows us to identify the leading causes of unintentional injury deaths. And you can see that the greatest share are attributed to motor vehicle crashes, 31.5%. Falls is often also a significant factor, accounting for 22%. The third category is called poisoning, or ingestion of noxious substances, but it also includes unintentional drug overdoses. And for a lot of communities, that is a growing portion. And in some communities, it has become the number one causes of unintentional deaths. Although that is not the case here, it remains in the third position. I'll talk a little bit more about drug overdoses when we get to the substance abuse issue, but I wanted to point out, related to motor vehicle crashes, if we look at age-adjusted death rates for motor vehicle deaths, that is significantly higher in Umatilla and Morrow counties than across Oregon or the US. some of the related information from our population survey found that only about 3 out of 4 of parents of preteens report that their child always uses a seatbelt. So that's a relatively low compliance for children in that age group. If I look at some of the data we collected related to violence, this is one question that emerged from our survey, for example. We found that about 1 out of 5 adults in Umatilla and Morrow counties reports intimate partner violence or domestic violence, meaning they've ever been hit, slapped, pushed, kicked, or hurt in some way by an intimate partner, someone they were dating, or a spouse, or romantically involved with. In a separate question, we also had about 3% of adults in the phone survey that told us that right now they do not feel safe in their own homes. Next, I'd like to share some findings around mental health, primarily but not exclusively from our phone population survey. We had a question similar to the first one I talked about today, asking people in this case to specifically rate their mental health status. So we asked them in terms of things like depression or anxiety or problems with emotions, would you rate your own mental health as excellent, very good, good, fair, or poor? And most, again, rated it as excellent or very good or at least good. But we did have 23% of adults that we surveyed who rate their mental health as either fair or poor. And that's high in comparison to what we see nationally, by nearly 10 percentage points. And equally high between the two community areas that we segmented, Hermiston and Pendleton areas. We also found that 24.9%, so 1 out of 4 adults that we surveyed, told us that they had been diagnosed with some type of depressive disorder by a healthcare professional at some point in the past. Close to what we see in a statewide survey, but higher than what we see nationally at 20.6%. And if we ask even more broadly about depression, regardless of whether someone was diagnosed or not, we found that 41.6% of all adults say that they have had a time in their past when they had 2 or more years when they felt sad or depressed on most days, even if they felt okay sometimes. Something that we call symptoms of chronic depression. So kind of 2 or more years, prolonged periods of feeling depressed or sad. That is higher also than we see nationally. It's about 30%, which is already a high percentage. In terms of demographics, we see it much higher in women, younger adults, certainly folks in that lower income group, and certainly higher in communities of color than we see among non-Hispanic white respondents in the community. Now, in a different question in the survey, we also found that about 1 out of 5 adults in Umatilla Morrow counties is currently receiving some type of treatment for mental health, either through medication or attending counseling or therapy or the like. That percentage is also a little bit higher than we see nationally as well. The next slide I want to share is information that's collected from the public health data, and again, from death certificate data, and that relates to suicide. So looking at suicide as a manner of death for 2017 to 2019 in Umatilla and Morrow counties, we see that accounts for 20.7 deaths for every 100,000 population, which is significantly above the US suicide mortality rate, closer to what we see across Oregon, which is historically had a higher suicide mortality than the US. In a question in our survey, also, I wanted to point out that we had 10.3% of adults that we surveyed telling us that they have seriously considered suicide in the past year. So about 10% of adults with suicide ideation in the past year. Moving on to nutrition, physical activity, and weight, interrelated issues. The first thing I want to share is taken from our survey of the residents. And in that population survey, we asked people to give us their height and their weight. And then from that, we calculated a body mass index, or a BMI value, for every respondent. And that BMI value is what places a person in a category of being underweight, healthy weight, overweight, or obese. So in our respondents, if we look at those with a BMI of 25 or higher, meaning that they are either overweight or obese, we found that to be the case for 76% of adults in Umatilla Morrow counties. So 3 out of 4 in that overweight obese category, which is significantly above what is seen for the state or the US overall, where it's less than 2/3, a little over 60%. If we look at the higher threshold of obesity, so this is a percentage that is included in the first chart, but just those with a BMI of 30 or higher, meaning that they are obese, that percentage for Umatilla and Morrow counties is 49.9%, so right about a half, which is too much higher than we see statewide and nationally. As you can see in both cases, a little bit of difference between the two areas within our targeted communities, but not to a statistically significant degree. We also did not see statistically significant variations in looking at these findings by gender or age or race, ethnicity, income level. So fairly high across all groups. In looking at some of the existing data that's out there and looking at where things are located in the community. For example, we found that 27.2% of adults in the 2-county area do not live within a half-mile of a large grocery store or supermarket. So by that measure, these people are identified to have lower food access. That proportion that live further is particularly true for those in Umatilla County versus those in Morrow, but overall higher than we see across the state or the US. We did have a survey question also that asked about accessing fresh fruits and vegetables, and we found that about 1 out of 5, 20.7% of adults, reported that for them it is very or somewhat difficult for them to buy fresh produce at a price that they can afford. So a little bit around the food access aspect of this. We also had a series of questions in the population survey asking people about the foods that they ate on the day prior to the survey. And from those questions, we were able to determine that it's really 27.4% of adults who seem to be getting that 5 or more servings of fruits and vegetables per day, which is a little below what we see nationally, where it's not even a third of the US population consuming fruits and vegetables at that level. Locally, We saw it even lower in the Hermiston area. We saw it lower in adults kind of in the middle age range of 40 to 64, but also significantly low in those in lower income households as well. So there was significant difference by income. We also had a series of questions around physical activity, including what types of activities, frequency, intensity, and duration of physical activities that people engaged in. And from those questions, we were able to determine whether people were meeting the CDC's physical activity recommendations. And for Umatilla and Morrow counties, we found that 16% were getting physical activity at the levels and frequency and duration to meet the CDC guidelines. That percentage you can see is relatively low compared to the state in the US, where it's still not even a quarter of those populations getting adequate levels of physical activity. By demographics, where we really saw the differences were certainly by age. Not uncommon, we see that physical activity tends to drop in older adults. But we also see a pretty strong correlation with income level. Those in that lower income group, again, less likely to meet physical activity recommendations compared to those at middle to higher incomes. The next set of slides I want to share kind of fall under this umbrella of potentially disabling conditions, which have to do with physical limitations, essentially, and those things that can limit our activities or impair quality of life. And to that point, in our survey, for example, we had a question that asked people if they are limited in any way in any activity due to a physical, mental, or emotional health issue. And that was true for about a third of our population, 32.4% in Umatilla and Morrow counties, which is comparatively high when we look at the US data for that same question, but really equally high between Hermiston and Pendleton areas. Similar across most demographics, although it was higher in women, older adults, as well as in lower income residents. And you can see in the call out box that I've pointed here, when we ask those with activity limitations what it is that limits their activities, many of the responses had to do with kind of mobility issues and musculoskeletal type things like back and neck problems, arthritis and joint issues, difficulty walking. But I think it's also notable to point out that number 3 on that list were issues we heard related to mental health, being a limiting factor for some folks in their activities. Through the course of the survey, we asked a lot of questions around various different conditions that people may have been diagnosed with. I've talked about a couple as it relates to diabetes, for example, high blood pressure, cholesterol. But we also asked questions about things like lung disease, kidney disease, depression, asthma, a variety of other factors. And looking across all of those kind of conditions, we found that a relatively high percentage of adults, 39% in the 2-county area, are dealing with 3 or more chronic conditions at the same time, which is relatively high compared to what we see nationally. And as you might expect, it really the biggest determining factor is age. Those in the older age groups tend to have multiple compounding health issues. But we also saw it higher in women than men, and we also saw a correlation with income level, meaning those in the lower income category more likely to be dealing with multiple chronic conditions. In a separate question, we also asked specifically about chronic pain. And I wanted to point out that that was a prevalence that was relatively high in Umatilla and Morrow counties as well. 23.6% have what we call high impact chronic pain, meaning that it has limited their activities on every day or on most days in the past 6 months. Significantly higher proportion than we see nationally. Kind of on the other side of the coin, we also saw a relatively high percentage of adults in Umatilla and Morrow counties who themselves are acting as a caregiver for a friend, family, or other relative who has some type of long-term illness, disability, or health issue. 28.8% are caregivers, higher than we see across the US. Those receiving their care are dealing with issues primarily around things like dementia, various types of mental illnesses, or various types of cancers. I want to share a few slides next around various respiratory diseases. And first, I'm going to talk about death rates, specifically death rates associated with what's called chronic lower respiratory disease, or CLRD. And this is a collection of respiratory conditions that includes things like emphysema and chronic bronchitis. So for Umatilla and Morrow counties, the age-adjusted mortality for CLRD is 49.3 per 100,000 population, higher than we see across the state and the US, suggesting a relatively high mortality rate associated with lung disease. But the other piece that I wanted to share here is some information that we built in around COVID-19. And specifically, I wanted to share some information as it relates to vaccination. We had a question in our population survey asking people if they'd received any COVID vaccine, even one shot, let alone 2 or 3 or maybe more pending. At the time of the surveys, which was late fall, early winter, we had about 2/3 of adults in Umatilla and Morrow counties, 67.4%, who said that they had received a COVID vaccination at that time. Conversely, about a third, 32.6%, had not. And we asked those folks what was their main reason for remaining unvaccinated. Some of the top reasons are listed on screen here, but the greatest share related to safety and trust, or a feel that the vaccine was not needed or unnecessary. Those made up a little more of half of the reasons for that group. Looking at this question geographically, we saw that vaccination levels were a little bit lower in Hermiston than in Pendleton. So about 67% in the Hermiston area versus about 74% in the Pendleton area. And I wanted to share this one because it's very new information. And two, if you recall at the very beginning, COVID-19 was one of those issues that the key informants identified as one of their top concerns for their community. In another question, we also asked parents taking our survey about their feelings around vaccination for children. And we found that a pretty significant share, almost half, of parents of children under the age of 18 relayed that they would not have their child vaccinated for COVID-19 if and when that was available for his or her age group. And that resistance to childhood vaccines was highest in the Hermiston area zip codes, compared with those in Pendleton. Moving on now to substance abuse. I know I touched a little bit on this earlier, but I wanted to share first some death rates that we use as kind of proxy measures of substance abuse issues in the community. At the left is age-adjusted mortality associated with cirrhosis or liver disease. Alcohol use, although not exclusively, is a leading contributor to liver disease deaths. And you can see that the rate of mortality, age-adjusted, in Umatilla and Morrow counties is significantly higher than we see across the state or the U.S. On the right side, I'm showing age-adjusted deaths per 100,000 population for deaths with the ingestion of drugs as an underlying cause. Now, this excludes intentional drug overdoses, so suicides. These are unintentional drug-related deaths, regardless of whether the drug was a prescribed medication or an illegal street drug. But by this measure, unrelated or unintentional drug-related deaths for Umatilla and Morrow counties, the rate is actually well below what we're seeing nationally, and actually a little bit lower also than what we see across the state. But we did also address a number of these issues through the course of the population survey, and I want to share some of those findings as well, because there may be some issues that those bring out that may not be evident in those death rates that I just shared. For example, we found that in the past year, a relatively high percentage of adults in Umatilla and Morrow counties reports having used a prescription opioid, an OxyContin or fentanyl or something of that sort. We did not ask whether it was legally or illegally used, whether it was prescribed or not prescribed, but really looked just at usage as kind of a precursor to those who may be prone to potential addiction issues. So relatively high in Umatilla and Morrow counties compared to the U.S. We see it mirror some of those populations with increased chronic pain, for example, increasing with age. We also see it much higher in the non-Hispanic white respondent group than we saw in communities of color. For those who reported experiencing high-impact chronic pain in our survey, about a third of those say that they have used prescription opioids in the past year to manage that pain. I wanted to share a couple of other items from the population survey. We had a series of questions asking about alcohol and other drug use and experiences. For example, 18.4% of adults were identified to be what we call excessive drinkers, meaning they had episodes of binge drinking or a high average number of drinks per day in the past month. By that measure, it is relatively low compared to what we see across the U.S. We had about 17% of adults who reported currently using marijuana or THC products. Only about 0.4% reporting some type of illicit drug use in the past month, meaning a prescription drug not legally prescribed to them or some type of street drug. Certainly we acknowledge that, that percentage, if anything, is potentially largely underreported. We had just under 5% of adults who say that they have at some point in their past sought help for substance abuse issues. And then the last topic area I want to talk about today, and really just one slide about this, relates to tobacco use. We asked people about, whether they are current users of tobacco products, and we found that 14.3% of adults in Umatilla and Morrow counties do use tobacco in one of its forms, including smoking, chewing tobacco, either every day or at least on some days. In terms of demographics, much higher usage in men than women, tends to be higher in older adults, those age 40 plus. For those who currently use tobacco, we saw about half of them say that they made an attempt, albeit an unsuccessful attempt, to quit tobacco use in the past year. And if you recall back to that earliest slide, tobacco was also one of those top 5 issues of concern for that key informant group. So I know that I have moved through a lot of data today. I'm hoping everybody was able to keep up, but I want to give some time for people to ask questions if they have any questions about the data that I've presented. Again, you can enter those into the chat or the questions dialog box that appear on your GoToWebinar dashboard. I don't believe we've had, let me see, I think I might have one question here. Let me see. Oops, give me one second. The question comes in and says, what is the reasoning behind such poor stats, and how does this data compare to similar rural counties in neighboring states, Idaho, Washington, California? What's the plan to combat the problems we're seeing in our rural communities? Again, I do want to point out that today I am specifically focusing on the negative because I wanted to present some of the challenges that are ahead. So there are many positive findings as well. So I apologize if this comes off as doom and gloom. It's really not. It's meant to allow us to prioritize health issues and begin to address those. So we do have some benchmarking available, like I said, at the state and the national levels. It's less easy to compare maybe to other specific communities or collections of communities who may be using a different approach or a different method for their assessment processes, but there is some opportunity to do that. And some of that will be part of the investigative work that follows this assessment process as the hospitals move into developing plans to address these. And I'll let them address that apart from today. Another question that came, oops, I'm sorry, didn't mean to advance. Another question that came through, would it be possible to get a copy of the survey questions from the phone interviews? So I believe the full assessment report is now available online on the hospital's websites. And that's going to give you more detailed information. And if you need anything beyond that, we can you can follow up with an email. Any additional questions that folks have, please drop those into the questions dialogue. I don't see any coming in at the moment. If you do have some, continue to add those. I can circle back if others come in. But what I want to move on to here is the part of the presentation I talked about for prioritizing. I want to get some input from this group around how would you suggest that we begin to prioritize these various health issues that I've talked about? And again, we're going to use that voting platform through Mentimeter, menti.com, to get your input. So in a few minutes, I'm going to have you grab your cell phone, tablet, open that web browser. But I want to explain the exercise a little more in depth first. So we're going to have you give a score, and actually 2 scores, for each of the health issues that I discussed today. So access to healthcare, cancer, diabetes, heart disease, and stroke. For each of those, I'm going to ask you to give it 2 scores. And the scores that you'll be assigning relate to 1, what we call scope and severity, essentially getting your input as to how big is this problem for Umatilla and Morrow County? How much is this a problem in terms of, how many people are affected and how we compare to some of those state and national benchmarks. But also think about, for that issue, to what degree does that lead to death or disability, or impact quality of life, or exacerbate other health issues? So for example, diabetes or tobacco use. How severe is that health issue in the population? The second score you will be asked to include is around what we call ability to impact. Essentially asking, is this a scenario where we can make a difference? So what's the likelihood of having a positive health impact? Think about not just the hospitals, but other organizations working collectively and collaboratively to address some of these health issues. What do you think the payoff for our efforts would be in changing some of those data that we saw? And I know this one is easy to get caught up in thinking, but what I want from you is more of an instinctual response. Essentially, we're trying to identify, which of these are lower hanging fruit versus which are those that may be much more difficult and much more longer term to address. So as we go into the voting exercise, for example, if you pulled it up on your cell phone, it would look something like this. For each of those scores would be on a scale of 1 to 10. So for the first example of access to health services, for scope and severity, you can rate it from 1 to 10. 1 meaning it's something that you think is very low prevalence in the community and not very consequential to people's health. 10 meaning it is very prevalent in comparison to other communities, other regions of the US, the state, and it is something that has very severe health consequences. Ability to impact, again, a 1 to 10 scale, that's very basic. 10 is something that you think we have a great opportunity to make a difference if we put our efforts into this health issue. 1, the opposite extreme, basically you think no matter what we do, we're not going to make a dent in this problem. So on a scale of 1 to 10 for scope and severity, and for ability to impact on each of those health issues. So I'm going to progress now to the voting slide. So pick up your cell phone, your tablet, open that web browser. Once again, if this doesn't automatically appear, go to the URL at the top, www.menti.com. Enter the code at top of the screen, 7821-8632. And this should appear for you. If it does not, feel free to reach out to me through the chat. Now, very important for this question, once you get through the series of questions, I want you to be sure to go to the very bottom and hit that submit button, because none of your scores will be transmitted to us until you scroll to the bottom and hit submit. And I know this exercise is going to take a little time, so I'm going to give you a few minutes to hear. I'm going to hide scores until we start to see a significant grouping come in, just because I don't want to shuffle things around too much or reveal anybody's individual voting. So I'll let you continue with this exercise. I will check in a minute here as well. So again, scroll down through each of those health issues and adjust the sliders to represent your score for scope and severity and ability to impact for each of those health issues. When you're done, all the way at the bottom of your browser screen, there should be a submit button. Be sure to hit that. And to see that we've had a handful of votes come in. We'll let a few more come in before I start to show some of these results. I would say that we have at least a majority of the responses available now. So I'm going to kind of reveal kind of where the voting is at the moment. So if you're voting still, continue to vote. Your vote will still count. These will shuffle around if there are votes still coming in. But I wanted to kind of outline and explain the chart that you're seeing up on screen. So one of the great things about this Menti system is that we get instantaneous feedback from you once you kind of close out and submit your information from these questions. Now, using these two scores, what I've done is plot these with scope and severity along the x-axis at bottom, ability to impact on the y on the left, And essentially then those placing closer to the upper right-hand corner of these squares are those approaching, I guess, what you might call a perfect score, most severe and most with the most ability to impact. So from these, we can kind of see how things are tiering out. So in the top health issues, according to your rankings, prioritize the highest are things like diabetes, nutrition, physical activity, and weight, and mental health. We kind of have a little kind of a second grouping here with infant health, family planning, access to healthcare, heart disease, stroke, and on down from there. So from this, we do see some overlap from the information that we saw, at the beginning of the data presentation from key informants of what they considered most severe. Certainly mental health was up there, as was diabetes and heart and those. So this is information that will be made available to the hospitals as they start to pull apart the assessment findings and decide where we go from here in terms of addressing some of the greatest health needs in the community. It looks like we may have received all the votes that have come in. So I'm going to kind of move on to close out the session. But if you are still voting, please know that you can still submit your vote and it will still count, even if we don't have it on the screen at the time. So please don't feel like I'm cutting you off there. But for the purposes of today, and that we are getting close to the close of our time, I'm going to turn it over to Emily Smith with CHI St. Anthony to kind of close out today's webinar. So Emily, I'll pass it to you.
Awesome. Thank you, Bruce. Thanks for joining us today. Our presentation and prioritization exercise was the first step in developing our, for Good Shepherd and St. Anthony's, individual Community Health Improvement Plan, or the CHIP, for 2022. We value your input, and your input on health priorities in our community will help pave the way for each organization in the coming years. With your help, we look forward to improving the health of our community that we all know and love. Thanks again for joining us today.
Thank you, everyone. Have a great day.